And as we know, women go through menopause as they age. But did you know men actually have a similar period of their life called andropause? Insider Dr. Danielle Martinez says this could be the reason you're feeling down.
Testosterone is the male hormone, which it's commonly known as the male hormone, but women also produce testosterone. Your ovaries and your adrenal glands will also produce testosterone. Women need to have a certain level. But it is the hormone that provides men with their secondary sex characteristics. It gives them the energy that they usually are used to, the sex drive. It helps with their sexual function. It also helps them just mentate normally. So men with low testosterone sometimes will feel blah. They feel a little bit, they just don't feel normal. They feel almost
like
lethargic. And not only lethargic, but they don't feel like they normally would. A lot of them will come in and say, "I just don't feel right."
Well, does that happen because as you age, that level goes down?
As we age, the level does go down. We don't have a very good grip as to what specifically your testosterone level should be depending on the age. We just have a normal range, which is 250 to 850. But we do know that as men get older, they can develop what we call andropause or menopause.
Right, which by the way, it's something I had no idea because as women, we eventually go through menopause. But men also go through, as you said, andropause, which is like their form of menopause.
Correct. The major difference is women, they hit a wall. Men, this is a slow decline over time. Certain things can accelerate this, but a lot of the symptoms are very similar. You can have the lack of focus, the low energy, the muscle loss,
the night
decreased
sweats,
motivation, the night sweats, absolutely. Insomnia, weight gain, bone loss, mood swings, depression. A lot of what we see with the female version of dropping of their hormone, their major hormone, the estrogens, we will see also in men as they begin to develop andropause or menopause.
And now, as sometimes in women, they go through early menopause, do you often see a lot of young men go through andropause as well?
Yes, we do, unfortunately. And I don't know why. I think it may have to do with a lot of the lifestyle choices that we're making nowadays, the American diet, not exercising enough, the high stresses, the drug use, the other medical problems that we're developing from not exercising, doing all these other things as well. And so yes, of course, we can develop. Now, what is premature? We don't quite understand that either. We know that we tend to see hypogonadism or low testosterone issues somewhere starting around 50s, 60s, but I've seen it as young as men in their teenage years and 20s.
Wow. Okay, so we talk about, when we have our women's health shows, we talk about hormone replacement therapy for women. Is the same available for men?
Yes, it is. It's very also controversial.
Why?
And we live in a society right now that's obsessed with testosterone. You open the local newspaper and you go to the sports section, you're going to find a ton of different places where you can go and it says, you may have low testosterone, please come here and we can replace your testosterone. It is available and it is very useful and great in certain patient populations that truly need it. That's the key word here, is if somebody really needs it. If your thyroid stops producing thyroid hormone, you need to replace your thyroid hormone.
So why is this one controversial?
Because I think a lot of people are being prescribed testosterone that probably did not need to be put on testosterone. They're not really counseled appropriately and they don't quite understand something as simple as, hey, by the way, this is for life. When a patient comes to me and says, oh, I took it for 3 months and I felt better, but now I feel terrible, I say, well, yeah, because it's meant to be taken for life. And so I think better education and better awareness as to what's the right way of taking these medications and who really should be on it and what are the risk factors if you're on it has to be implemented.
But they feel that this testosterone therapy is almost like a fountain of youth, like a rebirth in a way.
Yeah. That's, again, another misconception. I got a 60-year-old man come to me and say, well, I don't feel the same way I felt when I was 18 years old.
Well, you're not.
Right, correct. And the key is you do want to have normal testosterone levels because it's unhealthy to be hypogonad or having very low testosterone. Actually, it increased risk for heart attack and stroke and other medical problems. So.
Now we have another short video from the FDA that explains the potential dangers of taking bodybuilding supplements, and we'll talk about it after. Let's watch.
FDA has issued a public health advisory warning consumers to stop using products marketed for bodybuilding that claim to contain steroids or steroid-like substances. Although some of these products are marketed as dietary supplements, they are not dietary supplements. They are actually unapproved drugs. They contain synthetic steroid or steroid-like active ingredients. Be aware that these products have not been reviewed or approved by the FDA and are potentially harmful to your health. These products can be found online and in retail stores and are promoted as hormone products or alternatives to anabolic steroids for increasing muscle mass and strength. Many of these products make claims about the ability of the active ingredients to enhance or diminish androgen, estrogen, or progestin-like effects in the body.
These products may be associated with liver injury, kidney failure, blockage of an artery in the lung, and stroke. They may be associated with other serious health problems in adults and children too.
If you have been taking one of these products, FDA recommends that you stop immediately. You should also consult your healthcare professional if you're experiencing nausea, weakness or fatigue, fever, abdominal pain, chest pain, shortness of breath, yellowing of the skin or whites of the eyes, or brown discolored urine. FDA cautions that athletes taking these products may test positive for performance-enhancing drugs.
Consumers should report serious adverse events or problems associated with these products to FDA. They should go to the FDA webpage, fda.gov, and look for the link to MedWatch.
So too much of this is not a good thing. So having too much testosterone in the body, what does that mean?
Having too much, well, the video is great because it talks about something a little more extreme, which is more anabolic steroids and
which we see
over the counter.
so often.
Absolutely, yes. But having too much testosterone is not necessarily a problem. Your body produces it. If your body makes X amount of testosterone and you don't have some sort of testosterone producing tumor, that's fine, that's you. But when somebody is being prescribed testosterone and or taking it illegally or buying it from the streets and they're not monitoring themselves and their testosterones are super therapeutic, they are putting themselves at risk for increasing atherosclerosis, liver damage, other potential bodily harm.
You actually said, we were talking off camera, that it can cause infertility as well.
Oh,
or
absolutely.
Difficulty getting pregnant.
Yes, I see that quite often. A younger gentleman who is still potentially, maybe the wife is even younger and wants to have children, but they're on testosterone replacement therapy. Nobody told them, by the way, this may affect spermatogenesis. You may not be producing sperm.
Right.
And then they're wondering why they're unable to get pregnant. So again, it's a great therapy for those who truly need it. But the counseling and to be able to find the appropriate people who need to be on replacement therapy, I think that's key, and that's the part that unfortunately I think we're starting to lose in society nowadays.
To learn more about testosterone therapy, you can watch videos from our experts on our website, allhealthtv.com.